Scott Miller.
Wow, that was remarkable. Oh, thanks, Rich, for that introduction. I'm so pleased to be with you all, be able to chat about the work that our colleagues and I are doing on this subject of excellence. It really is an audacious title if you think about it. How can we be excellent at the work we do? And so before I talk about the steps to excellence, I want to give a nod to how effective we already are. If we take a look at the data here, whoa, that was loud. If we take a look, and we have the slides up here, and we look at just the facts at our work, what we do in our work, and in the studies we do, most studies of psychological treatments conducted over the last 30 years, the average treated person is better off than 80% of the untreated sample in most studies. Just take a moment and let that sink in. This is the way researchers speak to each other. They did not say that we had an 80% success rate, right? They're always comparing the treated group to the untreated group. So in a room full of untreated people, the one person who gets your care is going to be better off than 80% of those who did not. Are you with me here? This is a phenomenal effect size. It is equal to coronary artery bypass surgery. Is that amazing? It is 4 times the effect of fluoride in water. It's 27 times the effect of aspirin as a preventative for heart disease and stroke. We should put you guys in the water, is what we should do, right? You just turn on the faucet, a little therapist pops his head out, says, hey, how the hell you doing, all right? What you do really does work. It works really quite well. And in fact, if you look at data from randomized clinical trials, the average clinicians, if we can go back to the slides here, average clinician achieves outcomes on par with success rates in tightly controlled randomized clinical trials. This is very good news because most of the people you work with don't look like the people that are in randomized clinical trials. This is something I'm going to promise you because in those studies, even though they've made some progress, typically the clients in those studies are limited to a single diagnosis or problem. And so here you're working with so-called messy clients, clients where comorbidity is the rule, and again the data is really quite positive. What you do on a day-to-day basis works, it works quite well, and what is the pièce de résistance for me is that you accomplish these effects with a far more tolerable side effect profile. If there were an ad for what you do on TV every day, it wouldn't have to be followed by a 1-minute caveat that said, may cause diaphoresis, sweating, dry mouth, your hair to fall out, or an erection lasting 4 hours. Right? Because let's face it, if your work causes an erection lasting 4 hours, that was probably the point of the work that you're doing. What you do really does work. It works really quite well. There's no question about it. And if we don't start here, then when I start to talk about excellence, it can be quite discouraging. So let's just assume that we've all entered the Olympic trials. You've made it through the trials. You do good work with your clients. Would you do me a favor and turn to the person next to you, shake their hand and say, dang good job. Would you do that? Our field, unfortunately, suffers from terminally low self-esteem, and it is not deserved. Our outcomes, once again, are on par. But if in this increasingly competitive atmosphere in which we live, if we want to survive, average is not going to be good enough anymore. So let's talk about this because our success as a field has led to an explosion in the number of treatment models and choices. So we have we've gone from 60 to over 400 different treatment models in the last 50 years or so. 10,000 how-to books have been published during the same time period. Now this is just a small editorial comment, but let me say, any field that needs 10,000 books to describe what it's doing doesn't know what it's doing. But from the surface of it, just the number of books makes you impressed. It has to make you impressed, really. In addition, 145 manualized treatments for 51 of the 397 possible diagnostic groups in the DSM. If you go to the SAMHSA.gov website, listing lots and lots of different treatments that we can use. And again, from the outside, if somebody were to come from another planet, you would have to agree we've made a huge amount of progress.